All right. So, namaste from Mumbai, and I want to talk to you about another interesting remedy that we'll try to evolve today from few of our cases that we are trying to understand a remedy. The remedy today is a remedy that always comes up in the repertory sheet, and is a remedy we normally don't think of very often. So it's the remedy Valeriana. Let's try to study that. Valeriana, the remedy. First, I'll try to tell you which are the commonest indications in which Valeriana is mainly prescribed. And tell you previously what were the main indication on which I prescribed it. Valeriana, the main indication on which we would normally give it, which I've given it previously, were in very difficult cases of sciatica. That was the main keynote. The main indication of sciatica, as Pathak rightly writes, is typically the patients would often tell me is that a little bit very similar to Rouge-Stokes in that way, the sciatica, that the pain in the legs, the pain in the joints, the pain from hips going down towards the going from the hips down to the limbs, worse by standing and resting, which means as soon as they keep the foot like this on the ground, they get pain. And this pain is better after walking and rubbing that area. That's a very important indication. That's the top indication of the remedy Valeriana. The other indication of Valeriana, again, it's something that I've used, is in children's cases. In children's cases, if the mother has been very angry, has not been in a good state of mind, and she's been feeding the child can vomit. Child vomits curdled milk in large lumps, also stools, very similar to Ithuza, as soon as it has nurse after mother has been angry. So these are the two main indications on which you would probably normally think about Valerian. But as a request from few of my students and colleagues, I try to give you a little idea about Valerian, the remedy, and a little bit about the mental picture of Valerian. For me, the number one thing in Valeriana is the sudden change in mood. I think it's one of the most moody remedies in homeopathy. Somewhere it looks a little bit like Ignatia or Moschus. So mood changeable, sudden. 1 minute they are like okay, and another minute they are suddenly crying. Another minute they are angry. Another minute they are cheerful. Mood changeable. That would be a very, very important kind of state. Just connected to that is the hysterical state, which means that they are known to kind of, in a way, respond in a way a little over-exaggerated, which means that, for example, if someone says something, normally you would cry, someone would feel bad, they will act in a very weird way. They will suddenly start sobbing or suddenly faint or get unconscious. They will act in a very, very out of the box kind of reactions. Very, very hysterical. Everything is kind of out of proportion. Even if you see their laughing hysterical. I mean, they will not stop laughing. It will be crazy. Even you see this rubric, weeping alternating with laughing. Look at this another rubric, yielding, which means they will listen to everything, alternating with obstinacy. No, I'll not do this. No. And another minute, okay, I'll do it. So this kind of sudden change in mood, 1 minute, and that's why it looks almost like Ignatia. What's the difference? Ignatia at some level have this kind of emotional suppression, grief, silent, undemonstrated. That is something which is not there in Valeriana. In Valeriana, there's a very nice symptom in Pathak. He's written here and there. They are like this here and there. They're just very inconstant. There's a nice rubric here by Kent. Inconstant. Very interesting. But you may sometimes get it mixed with calcaria because there are some very strong fears like calcaria. Have a look. Fear in children, fear of being alone in darkness, fear of dark, fear of ghosts. So there's a lot of fear. Fear of being injured in the dark. So there's a lot of fear of pain. If I just show you this, you'll think about stramonium or calcaria card, fear of narrow places. Very interesting. Fright ailments from. Again, so it gives you a little idea of calcaria, it gives you a little idea of ignatia. But mainly, the mood is very, very changeable. But what is the other thing that I've seen? Is they are worst at home. They're worst being inside a narrow place. They're worst being inside a room, especially warm room. They're hot patients. And what do they love? They just love going out of the house. Wander desire. Walking must. Walking ameliorate. Valerian. They are also, in my experience, very vivacious, very moody, lot of emotions, lot of ideas. Many thoughts rapid. Thoughts, very nice jar is given. Thoughts rush flow up as if drunk. Valerian. There's also a strong sensitivity to pain. Sensitive to pain, sensitive to odor, sensitive to noise. So oversensitive is a very important state of Valeriana. And to this is the other rubric, that is unconsciousness from pain. So much of pain will get unconscious. Valeriana. Some delusions. Sometimes they may get delusion, a lot of imagination. Someone is there with her. Some figures are there. Someone is there. She sees people. The other thing, as if poison, someone has done something to them. Everything is strange and disagreeable. Patak. Sab kuch ajeeb hai. Everything looks strange. So they want a lot of comfort zone. Many dreams. There are people who will get many dreams. Very, 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 very expressive patient. Valerian. Patak very beautifully writes. Produces the oversensitivity of nerves, spinal, genitourinary, affects the mind, muscles, calf, heels, tendonitis. Mental and physical disposition change suddenly and go to extreme. This is the main thing. Everything goes to extreme. This is a very important thing for Valerian. They cannot sit still. So restless, impulsive to move, cannot keep still. Very hysterical. Illusions of vision, hearing, smell, taste. Suddenly I feel there is some stools or vomit around, but everything is okay. So they get perverted smell. Everything is in a way perverted. And finally, nervous, irritable, weak, hysterical women in whom intellectual facilities predominate, who suffer from neuralgia. Valeriana get all these kind of very strange pains. They go to different allopathic doctors. Doctor, I am getting pain. The allopathic doctor examines, evaluates. They say, you shouldn't get the pain, You shouldn't get the pain because everything is normal. But they just don't know. They go to different doctors and finally meet homeopaths. And if the homeopath can really find the remedy, if it is Valeriana, it will help. And that's why another remedy, Zincum Valeriana, has also a state very similar to this. It's a very important pain, neuralgic pain remedy. Always Valeriana will have something to do with nerves, neuralgia. See, there is a very nice line here. Agitation of all nerves, jerks, twitches, trembling. So it's a very neurological remedy. They often have not a clear diagnosis of the case. This is also very interesting for Valerian. And that's when they try to have, then that's when there is a very, very, very famous rubric of Valeriana, which I like a lot. emotions controlled by intellect. They get so emotional that at some point in their life, they try to control this emotion with their intellect. This is very typical for Valerian. So it's a very interesting remedy, very, very excitable remedy. That's why you can see many excitable rubric. Look at this: excitement, intoxicated, excitement, violent, extreme. Interesting. Lot of desire for stimulants like coffee, tonics. This is Valerian. I hope you got an idea about this remedy. And I'm teaching many of these remedies in our course, advanced course, where every week I teach remedies with about 20 of my colleagues. We are teaching different topics, organon, materia medica, repertory to the next level. If you wish to join us, to study with us, just write an email to me at gaurang@gmail.com. I would love to mentor you. In fact, study with you in our study group. Keep in touch. Thank you.